Thank you very much. Is there a panelist that you would like to direct the question to? It's open. Okay. Okay, so let me open it up to our three distinguished panelists. If anyone would like to answer the question related to community level and disaster medicine.
Thank you. Let me share about the experience for Timor-Leste. Since we have the autonomy of the ambulance and emergency services, one of the units we work about the emergency and disaster. And this unit or department, as I mentioned, we conducted the training from the national level, and we do the TUT, and then the training continued until to the community health level, and then that's what we are doing in Timor context. So, because as Timor is not like India, it's huge. Timor is small, but the way that we treat, or the way that we encourage our community to involve is quite successful. Yeah.
Well, as for Thailand, I would say the volunteer and community worker were actually the key point, the key entrance to Bangkok Principle. And during the COVID-19, they were working so hard and actively, and they are the one who's reduced the number of the people who infected with COVID-19. In Thailand, we have village health volunteer. And those are the people at the community level that were trained in basic community health practices. They can do first response for health, of course, and some of them were also trained in disaster response. So those are two combinations that we start at the grassroots, at the community. We not only have those programs, it's also in our act. You know, those volunteers get compensated. You know, they get recognition, they get social recognition at the higher level as well. So, you know, in building a strong volunteer, not only a system that we need, we also need to have the social rewards. They need to be recognized because they are such a crucial part in driving the disaster risk management and the health, especially in the health sector.
And then maybe I can add another thing that experience from Timor during the COVID is the volunteer is not coming from the government itself, but also from the other partners and also other society like our Red Cross and also partners. It's very, very useful because during COVID, the Timor context is human resource, everything is really limited. But with the communication and coordination with the partners and the others, multi-sectoral is very, very useful for us, and then we can overpass the situation.